Hello everyone, my name is Gail, and today we're going to be talking to you about the hospital experience. So we know that autistic people are much more likely to visit the hospital and have greater healthcare requirements than the non-autistic population. Yet we know from a lot of research in this area that autistic people and their families frequently report a lot of challenges about their hospital experiences and barriers to receiving healthcare. So the review that we have linked to you today was conducted by Australian researchers wanting to understand the reported experiences of autistic people in hospital settings and identify gaps in knowledge for providers and policymakers. So to do this, the researchers conducted a really large scoping review, identifying 30 other papers that had looked at the experiences of autistic people in hospitals. Most of these papers had actually been published since 2016, so really recent data. And now there were two main themes that arose from this review. One related to the challenges that were being experienced in hospital settings, and the other related to facilitators or factors that work to improve the hospital experience. So for example, some papers reported that autistic people had negative experiences relating to communication difficulties, for example, expressing pain or sensory needs, challenges associated with disclosing being autistic in hospital settings and the incorrect assumptions that can be made with this, and other challenges relating to hospital systems and processes, so limited knowledge and experience in the people providing care. Other papers actually reported a range of factors that act to improve the experience in hospitals. For example, provision of care pathways that can support speedier diagnoses and equip staff to understand the needs of individuals through the hospital journey. And other factors included having a really good partnership with parents and families to facilitate effective communication throughout the process, as well as the provision of specialised resources like quiet rooms or alternative communication tools, and the use of simple language in explaining procedures that were needed. The broad findings from these reviews really highlight that there are some key challenges, but also some really important factors that can improve the hospital experience for autistic people. And we already know that autistic people have to engage with healthcare services more frequently than the non-autistic population and are more likely to need to go to hospital. So we now urgently need to work together to co-design some solutions that acknowledge the unique needs of autistic people and enable equitable access to healthcare.